Hello friends, I'm Dr. Arun Kalyanasundaram. I'm an interventional cardiologist, Promed Hospital, Chennai. COVID-19 has impacted everybody pretty much. I think there's not a single soul on planet Earth whose life has not been affected by the COVID virus. It's obviously, it's hopefully once in a century kind of an event. It definitely has had a huge impact on healthcare and cardiac care in particular. So if you think about it, COVID, at least when it first came out, people thought this was mostly a respiratory illness and it affects the lungs, etc. Then, a couple of weeks, months into it, we kind of kept hearing about how it affects other parts of the body, including the heart, and specifically how does it impact the heart. It can cause blockages in the blood vessel supply to the heart that essentially, and there have been patients, and I've taken care of some myself, who essentially present with a heart attack, and that was their event that actually led them to be diagnosed with the COVID virus itself. So that's one. Some people have had rhythm problems. Some patients have had just what we call an inflammation of the heart muscle itself, myocarditis. So there are myriad ways by which COVID can affect the heart. That's one. And now there's another way in which COVID has really affected cardiac care. Unfortunately, despite COVID hogging the headlines and everything else, people continue to have medical problems. They continue to languish with heart disease. Heart attacks still happen. Strokes still happen. So, the fear and this fear of the unknown, and initially, appropriately so, we were dealing with something that we have not dealt with in our lifetime. So a lot of people were, we were in lockdown, whatnot. So a lot of people were very hesitant to seek medical attention, even when they ought to seek medical attention. Like, they might, we have had patients, and personally I've taken care of someone who is, running around from pillar to post and to almost 3 hospitals before they ended up here with a heart attack. And this was actually the patient who did venture to go out. There were many that did not. And this is not just an event in India, but globally. There have been some really rapid advancements, I would say, in this technology. And I was privileged to be part of what we call the partner trial, which was one of the first trials where the aortic valve could be replaced without cutting the chest open, when I was a trainee at the Cleveland Clinic, where we could, and this is now, it's a pretty accepted technology now. People can actually, without cutting the chest open, go in and replace valves, repair valves, etc. Now, is everyone a candidate for it? No, but many can be done. The second big advancement, I would say, is probably in the area of opening up blockages. Traditionally, if you look at people with heart blockages, other than for the simple ones, bypass surgery was pretty much the only option. In today's day and age, I can confidently tell you, because that's really my area of expertise and focus in cardiology, any blockage can be opened and pretty much safely. Now, so the key is this patient going to be better served by bypass surgery in the long run or not? So there is still a certain segment of population that would benefit from bypass surgery. And I always equate that to, playing a trump card when you're playing cards. You have bypass surgery once, and typically one of the grafts stays open, called the lemur. And sometimes, or after many, many years, some of the other grafts close, and you've already played your trump card. And now patients still have blockages, and there's no way of, there's no need, I would say, for subjecting them to a much riskier second bypass surgery. So the rest of the vessels, those are blocked, and even those that have been blocked for a very, very long time completely can be pretty much opened with very high success rates and incredibly in a safe manner. So I trained at the Cleveland Clinic, where I did my interventional cardiology fellowship, and subsequently I specialized in chronic total occlusion angioplasty, or CTO-PCI. This is the most complex angioplasty. In general, when we talk about complex angioplasty, CTO angioplasty is considered the most complex amongst all elective procedures in the coronary space. So this was my area of forte, and I started proctoring in the US. And then during my travels, where I was traveling to other hospitals to teach other doctors how to do these complex angioplasties, I did move back. One of the opportunities I had was to proctor in Asia. And when I did come to South Asia and the Indian subcontinent, I realized that there were a lot of patients here who had very difficult blockages, and where I felt like I could make a big difference in terms of not just training other cardiologists, but me also performing some of these complex angioplasties. So this really was an impetus for me to move back from the States, back to Chennai, India. It was at that time that we set up Promed Hospital. And the whole idea was to establish a center that focused not exclusively, but predominantly in I would say, advanced cardiac care. Um, and the mission was twofold. One is a place where we could do really complex angioplasties at a world class level with very high success rates and incredibly safely. And that was really the rationale for setting up this particular institution. And also, this was a place where, despite COVID times, we have done 4 international live workshops where we were beaming from here to other during a conference where we could kind of showcase what we were doing here to other doctors. So this is a place where we could teach and train, I would say, younger cardiologists in terms of these advanced techniques, so that it's not just one person doing really complex stuff, but a lot of people taking care of patients the way they ought to be taken care of. So presently we have one center where we offer specialized cardiac care pretty much. The goal is to also make this, right now, at this place, we try and we aspire to treat patients regardless of their ability to pay. And we want to bring affordable cardiac care to the vast majority of the population. And I'm talking not just about the chip shot, easy angioplasties, but even the complex angioplasties. That's kind of the vision, I would say, of the organization. And the goal is to be able to kind of replicate this. And again, I'm fairly new to the Indian market and to the Indian scenario. But over the last year plus, I think I've gained some experience, and the goal is to be able to replicate this in other cities and other centers, so that not just people don't have to just fly to Chennai to be taken care of, but we could offer this kind of care at a place closer to the patient's home. So that, I would say, is kind of the where I see this going forward in the next several years, hopefully.